Hello, viewers. Thank you for being here once again. Today, I am bringing to you Dr. Sanjay Agrawal. He is a veteran pharmacologist. He has been in this industry for the last 35 years with, I think so, 42 patents under his belt. I am just looking forward to this conversation today, and I hope it brings you a lot of material to take back home, ponder over, and decide on your own as to what kind of medications should we take, how should we take, are supplements important, and many, many more. I look forward to this conversation. Welcome, sir. Welcome, board. So do you think the advancement on the field of medical research is making people more and more dependent on medications, especially supplements, antibiotics, and steroids?
Actually, the advancement in the sciences is really profitable to the public, the health industry. But only the difficulty, lot of dependency is there. And due to dependency, the people are taking the due advantage or misadvantages of our drugs, especially the steroids, about the antibiotics, the antipyretics. They misuse that, and they don't follow the regime which we require, maybe 5 days, 7 days. They are taking so self medication, and that is why the advancement is good, but it has gone to the public in such a extensive way that they are going to use very extensively. They are not going for the natural therapies. They don't follow our conventional ideas. And their conventional ideas are more good for us. Good for us.
Okay. The second thought that I have in my mind is, sir, popping in pills. We just pop in pills whenever we have a headache or a stomach ache or whatever. There are so many over-the-counter pills which we get now without any prescription. Sir, and it has become a very common practice. Self-medication is a norm these days. Popping up paracetamol or a painkiller is considered pretty okay. Sometimes people even take antibiotics on their own, sir. So
it's true.
What is your say on this? Is it a very good practice, or is it a okay practice to do, or should we always consult a doctor before taking medicines?
Actually, the popping pills without a proper guidance, and especially for the common issues like pain or fever, can have unintended consequences. And overuse of the painkillers or the antibiotics without the prescription, and people are using for the long duration because they have not consulted the physician, they have not consulted the family physician, and they are going to indulge for the long time. There will some complication on the body physiology and body organs.
There was recently a study on a particular paracetamol brand that its overuse had caused a lot of kidney failures. What do you have to say about that?
Yes, it's a very common, because the earlier our doses was 8 to 15 milligram per kilogram body weight. But now our doctors, even the patients, and they are going to the chemist, they are buying them, and they are taking 15 to 20 milligram per kilogram body weight per day.
My goodness.
And that is why the number of kidney failure cases and liver failure cases are very high these days. I remember after COVID-19, earlier it was 500 milligram, the tablet was available. Now 650 milligram is available. And patients are going to the chemist. Yeah, patients are going to my chemist and asking, give me the paracetamol. And my pharmacist is giving 650 milligram of the paracetamol. 3 to 4 times he is taking it. And definitely the complications will come. And that is why after the COVID, the number of cases of liver failure, of kidney failure has become extensively raised all over the country.
Sir, according to you, what is the suggestive dose that can be administered in paracetamol?
Actually, the paracetamol, we should take 8 to 15 milligram per kilogram body weight per day, not more than that. The 500 milligram at a glance 3 times a day. And children should be 125 milligram in each 5 ml, not 250 milligram. Because these are
For
the
how many
symptomatic
days?
drugs.
How many
At
days
least for
maximum?
because these are the symptomatic drugs. Till your symptoms are there, you take. And once your symptoms are over, your pyrexia is over, your fever is over, you should withdraw it. No, why you want to continue for 10 to 15 days? It is not antibiotic that the bacterial resistance will come. It is antipyretic. It is analgesic. No? So as soon as your symptoms are over, it is applicable for cough and cold also. Till you have a cold, you take the anti-cold preparations. When the cold is over, you can withdraw. Like anti-allergic medicines, anti-allergic, till your allergy is there, you take anti-allergic. Once the allergy is over, then you should withdraw it. No, why you want to take months together?
Okay.
So that, yeah, and the medicines are not a chocolate or Cadbury. When you suffer, then you take. Why you want to that? You are drinking like Coca-Cola or something. As soon as the symptoms are over, you withdraw it. Should
So we
not
have
continue it.
this is done for paracetamol. Now I'm coming to painkillers, analgesics, sir. So how does painkillers work in our body? Like how much can we take, and should we or should we not?
Actually, the analgesics, no, it is a subjective matter. Subjective.
Okay.
Analgesics are normally, until and unless there is no pathology, should not use it. Because analgesics are more toxic than any drug in the world. They are more toxic. The best still safe is a paracetamol. When you talk the diclofenac, ibuprofen, the people they take ibuprofen derivatives. I do not want to take the name of the brand. The extensively number of cases are increasing a lot with the ibuprofen. Anaphylactic shock is there today. A lot of people they are getting shocked and difficult to protect them. So these analgesics should not be used without the doctor's prescription.
So, sir,
Paracetamol.
digging a little deeper into this, sir, I want to ask a question. That is, there are some major cases in which our body really needs to be eased of the pain. For example, if somebody has a bad headache, I don't know whether it is migraine or sinus or anything. That is one case. And the other that I have seen in women, that is menstrual cramps. In both these cases, there are some medicines which are taken. Like I remember during my, like I had bad migraine. Thankfully, I have managed to combat it a little by now. But I used to take Disprin. What do you have to say about like having a medicine which is a flam group, any of the anzoflam or combiflam or those kind of flams. And the other side, you have Disprin. So does Disprin is a safer choice, or like we shouldn't be taking it either?
No, the Disprin should not be used at all. There was a time when Disprin, when it was be cultivated or it was innovated, the role was different. But today the role is different. Because please remember, the medicines are dynamic, not static. They are dynamic. As our body physiology is changing very fast, similarly the medicines are also changing very fast. Their line of action. So when the Disprin came, it was a very mild analgesic. Okay. Now we are using as a anticoagulant.
Yes,
most of the
I'm aware.
cardiologists,
Yes,
so
yes.
that is why the Disprin is not advisable at all as a painkiller, as an antipyretic.
Sir, what does Disprin do? What is Disprin's role?
The Disprin role is there is a one chemical which normally appeared, and due to that chemical, we call neurotransmitter, the inflammation occurs, or pain occurs.
Okay.
And that when you take Disprin or any analgesic, they subside that chemical. Due to that chemical, there is inflammation, there is a pain, there is a pyrexia, lack of movement is there, lack of, many symptoms are there. and that is why your doctor judges that my patient suffers with the inflammation.
Okay.
So Disprin is only one character. It's a mild analgesic only, or little antibiotic. No other action is there. But when you have a pyrexia, definitely you require analgesic also.
Okay.
It should be good analgesic and would be very good to the antipyretic. So aspirin is a very mild.
You can brief what is pyrexia, sir.
The fever, no? If you see, when you have a fever, you definitely require a painkiller also, because they are simultaneously going on. There
But
is
then
a
that is
third.
already given in a paracetamol, right?
Yes, but aspirin is altogether is not advisable as a painkiller or as a for reducing the fever. It
Okay.
is good as a anticoagulant, anticoagulant. That is why our cardiologists, they constantly prescribing after 40 years with the statin or any other preparation which they want to control the hypertension or other complications.
Understood, sir. The next thing is, if I'm coming to, I did ask you a question on the having menstrual cramps. Women have it in younger age, it's major, and they will pop in a painkiller. So to your suggestion, is that okay? And if they do it, which is a milder one? Which are the milder ones that they can have?
Actually, for menstrual pain, the most advisable medicine today is mefenmic acid. The
Maftal,
mefenmic acid,
Maftal, I know.
yes, the mefenmic acid is more advisable because the mefenmic acid subside the cramps,
Okay,
as well as that time the women require analgesic action also, antispasmodic action also.
okay,
So she does not require antipyretic or anti-inflammatory, but she require antispasmodic with
correct.
painkiller. So I think the mefenmic acid is more advisable, which is little mild and safe. And for menstruation, she has to use for 2 days or 3 days.
Correct.
So she will feel really good
That is the
when
safe.
she will use my mefenmic acid with paracetamol preparations.
Thank you for this, sir. So next is, popping antibiotics. So now that we already know what are the common antibiotics available in the market and what is working, or maybe we just ask if somebody's got a viral, we'll ask, did doctor give you an antibiotic? And say, yes. What is the antibiotic? Okay, fine. I go to the counter and buy the same antibiotic and have when I am having viral. What do you have to say about this, sir? Is this a good practice, or is like for antibiotics, we should look for like a doctor's prescription instead of just, self-medicating?
Actually, there are two different drugs in the world
Mhm.
where the doctors, even the public, should be very careful before taking them. One is a steroid, and
Correct.
another is the antibiotics. Their complications will not come immediately, but their complications will come extensively with the time. If you are taking the painkiller for some time, the complications will come immediately, hyperacidity.
Correct.
And you will analyze, yes, I took the analgesic and that causes the hyperacidity. So you will definitely take some remedy. But for the steroids, the complications will come, or antibiotic complications will come later on. And that time, to protect the patient, it will be very difficult. So these two classes, now, antibiotics and steroid, we should not use without doctor's prescription. And if doctor is writing for 5 days, 7 days, we should very stick to that.
Correct.
If he is writing any antibiotic for 2 days, twice in a day or 3 times a day, we should not take 4 times, or we should not take a booster dose. There are certain patients, they do not want to take 3 times or 2 times, so they take booster at it, or they are taking 2 doses at a time. And
So we
once you're taking, yes, but then the extensive load will be there on your kidney, even the liver also.
Sir, could you please give us
Ultimately,
some more negative effects of, having antibiotics? What are the negative effects?
Most important effect is the bacterial resistance. Bacterial.
Okay.
If you are taking the
Wrong.
yes, the doses, correct doses you are not taking, or you are taking sub-therapeutic dose. If you require 500 milligram and if you are taking 250 milligram, definitely you will not cure. And ultimately, the once you will not cure, you will increase my strength. Instead of 250 milligram, you will improve 500 milligram.
Correct.
And if you are not following the schedule, instead of giving twice in a day, if you are taking once in a day, definitely the meantime your bacteria will multiply. And once the bacteria will multiply, how will you check them? So that is why the antibiotic should remain in time and with the specific concentration in your blood. So the antibiotic can fight with the bacteria. And once the bacterial the growth is over, they are inhibited, we should immediately withdraw the antibiotic. So whatever the schedule has been prescribed by your doctor, the patient should follow it.
Okay.
Due
Thank
to the
you.
whatever the complications are going on in the world, every day we are coming out the new antibiotics. But how much, Now we are on the extreme. There are certain
Yeah.
classes of antibiotic now, further innovation is not there. And that is why what we are doing it. We are doing to increasing the number of days. Like azithromycin, we were using 3 days in a for a course. Now we have gone to 5 days. Earlier we were giving 250 milligram azithromycin. Now we are taking 500 milligram. A time will come, then 750 milligram will come.
My
So
God.
ultimately, you will check the infection, but simultaneously the complications. The
So
complication will revive.
I have a counter question this. What is the role of flu vaccines in that case? Suppose we are so used to coming under the influence of viral every year, I don't know, 2 times, 3 times, we'll get viral. So nowadays we notice that doctors are suggesting we take flu vaccine. So recently, in the month of November, I took a flu vaccine. And just a few days back, I'm just out of my flu. So I want to know, does it at all work or where does it work?
Actually, the vaccines, and especially for viral vaccine,
Uh-huh.
are difficult to say. Difficult to say whether they are effective or not, because the virus keep on changing the strain. If we have developed any vaccine for the strain A, and you have taken the vaccine as a prophylactic, that again I should not have a viral infection. But you do not know the in between the virus will change its variety. And once the variety is changed, your earlier vaccine is over. Then you have to generate new vaccine. So vaccines has a limitation, has a limitation. So I don't prefer that we should use a vaccine for the viral infection. I don't say
But
that
then
it
what
should be
is the role
effective.
of the flu vaccine in that case?
It's improved your body immunity,
Acha.
your body immunity, and they fight against the viral the virus which has been entered in your body to it will fight with
Fight
that
back
virus.
better. Sir, it had been very difficult to get your appointment. We really worked hard on this. So thank you for giving me this appointment. But this particular topic, sir, on viral infection and the regular diseases that we face every single day, I would really like to have another session with you another day because I still have too many questions to ask you. So we'll keep this aside and go into supplements, sir. So,
Correct.
of late, we notice that we are living on supplements. Every time we are living on supplements, whatever, whether it is vitamins, it is minerals, calcium, iron, we are all popping a supplement pill. Do you think this is a decent idea to have supplements regularly or in short span, or what should we do? Because we are not being able to get the nutrients from the regular food that we eat these days because it's so loaded with lead and chemicals. I don't know. We are not being able to go to an organic shop every time. Not everybody can afford organic food. So we are living on supplements. What is your say on this, sir?
See, actually, the nutraceuticals, if you see the definition, the nutraceuticals are those contents which are available in our nutrition, in our in every day what we eat. But due to our habits have changed, and we are going for fast food and junk food, where
Correct.
you'll get more, saturated fats, the lack of vitamins, lack of minerals, lack of other amino acids are there. So these supplements are really, they are useful. They are profitable to the body. I cannot say it is a placebo.
Okay.
Earlier, the doctors were thinking this is a placebo. Now it has been proven that the vitamins, minerals, amino acid, they work in the body, and our body requires. There are many examples are there, and even you must have experienced like the angular stomatitis is there. छाले पड़ जाते हैं. And if you use my folic acid, 5 milligram, 3, 4 times, 5 times, you crush with your teeth, I think with a couple of hours, the stomatitis will be over. So we should, yes. So actually, talking like it is these nutraceutical as placebo, I think it is wrong misconception. The doctors themselves, they have seen, the people are also observing, and there are variety of complications are there which can be, subside with our nutraceuticals, can be subside, that can be controlled. I'll give you the example of diabetes is very common. Hypertension is very common. If you use our nutraceutical along with your line of treatment, maybe in diabetes you are taking metformin or teniglyptin. If you take our vitamins like methylcobalamin or alpha lipoic acid, there is a synergism. Our nutraceutical will help to the drug. If the
Correct.
drug is working 70%, the 30% will be, my nutraceutical will help to control the diabetes and hypertension. So it is a well proven today. So if you take the minerals or vitamins or amino acid, I think we can protect our patients. We can protect. And earlier, there was a definition that nutraceuticals are, for it is for prophylactic.
Okay.
But
So
now it
what
is
you're saying,
being,
what you're telling by now is all about vitamins and minerals. But
yes, Bukul.
what about the
You're talking
protein?
about the,
We drink protein powders and all. What do you suggest about that?
we should use, but with the due, approved or prescribed by the doctors. When
Okay.
you
The
take the protein by
nutritionist should
yourself,
prescribe it, not anything
yes,
on your own.
when you, yes. See, everything is dangerous when you, cross the limit, no. When you take overdose, definitely, whether it is a nutraceutical or whether it's a drug or anything, when you eat more, definitely you will have some complication. Your body requires 2 chapatis, and if you take 4 chapati, definitely some complications will come, no. So same principle is applicable to my nutraceutical also. If when your stomatitis is over, why you want to take folic acid for a long time? You should withdraw immediately.
Correct.
When diabetic is controlled, I cannot say it is a cure, but controlled. Try to withdraw your some of the drugs, no. So the load will not come. Load on your kidney, load on your liver. It will not come, and you can protect your body physiology properly.
Okay.
So that is our today's goal, that the nutraceutical people say it is safe, but not completely safe. They have also some complications. They have also some drug interaction. But today we have not analyzed the drug interaction. And that is why we are constantly writing along with the drug. So nutraceutical, they have a role in the body. They are not placebo.
Sir, my next question is, um, especially in women these days, we see a lot of iron deficiency. And India is known as one of the anemia capitals in the world. What do you have to say about women going through so much of anemia, and why is it so difficult for us to absorb iron in our body? what is the way we can absorb iron in our body? If you could address this for the females, it would be nice. We lose a lot of blood every
Yes,
month.
correct. Actually, if we say the iron deficiency is prevailing more in India, it's a misconception.
Oh,
All
okay.
over the world, the anemia and iron deficiency is very common. And basically, the iron deficiency is indeed a widespread issue, particularly among children and women.
Yes.
Not only women, children are also. And several factors contribute to this. The one that dietary factors, the inadequate intake of iron-rich food is primary contributor. And iron is found in two forms, heme iron and non-heme iron. Heme iron, which we get non-vegetarian sources, and non-heme iron, which we get from the plant sources. And when we take from the plant sources, definitely the absorption will go over the heme iron.
Oh,
And in India, India, we are a vegetarian most of the time,
most of
and
us are
that is why,
vegetarian.
so that is why the absorption is poor. Number two, the bioavailability of the iron. The non-heme iron, the form which we get from the plant, they have a poorly absorbed by the body. And that is why once they are absorbed poorly, definitely their availability in the body will be very less. Due to we are taking more from the vegetarian sources. Number three factor is a loss of iron. In the menstruation, women lose iron extensively. And similarly, in the pregnant women, they also require iron when the child is growing. So, and the most important part is their poor iron absorption. It is one of the factors, So the body ability to absorb iron is influenced by the various factors. The iron absorption is higher when the body needs more iron, but the condition like chronic inflammation or certain medical condition can interfere the absorption.
So one moment.
To improve,
If, like for example, if I have to take iron supplements, if I am supplementing, then what is it that we need to have with iron for the for better absorption?
actually, when you want to improve the bioavailability of the iron, and being you are a vegetarian, the most important is there you should take some ascorbic acid, vitamin C.
Okay.
So once you take the vitamin C, definitely it will help the absorption of the iron. And when you take the iron preparation, please take care that tea, coffee is prohibited. Number three, don't use a calcium preparation along with the iron.
Okay.
Because calcium hampers or it inhibits the absorption of the iron. So the most important that when you take the iron, you should improve or increase the quantity of the vitamin C. It will definitely help you. And avoid the fiber preparations. When you take the fiber preparations along with the iron, the fibers, salad and all, definitely it will stop or it will inhibit the absorption of the iron.
So in that case, what is the right time of taking an iron capsule?
See, the iron, when you want that iron absorption should be good, it means your body pH or stomach pH should be acidic.
So
it
morning.
should be 4.
Morning.
Yes. So once, when you, not morning, when you eat when you are going for the lunch, that time the body require more acid because there are certain enzymes are there. They are only activated in the acidic pH, not in alkaline.
Okay.
In morning, your pH is not acidic, it is little more alkaline.
Okay.
After taking your tea, then it's become acidic.
Okay.
Once you are going for the breakfast, it's become more acidic. And when you are going for the lunch, it's become pure acidic. So when you take, once your lunch is over, that time you should take your iron preparations.
Okay.
Because once you take the iron preparation
with vitamin.
after the lunch, so yes,
with
vitamins.
Vitamin C.
So definitely vitamin C, when you're taking with the lunch, then there is no need to taking more amount of vitamin C. Vitamin C will change the pH of the stomach, no? Only to
when to
improve
take
the
the vitamin
absorption of the iron.
So when
Yes,
to
yes. So you should take the iron preparation after the lunch, which is the most advisable.
and when should I take the C? Vitamin C.
Vitamin C can be used anytime.
Okay.
You can take anytime. And
Not with lunch.
if you are, no, in case if you are taking iron with vitamin C after the lunch, it is not anything harm, no? It is
Okay.
not harmful. But there is no necessity to take the vitamin C, iron with lunch. You can
Okay.
escape the vitamin C.
At that time. Okay. Calcium deficiency. This is another issue in these days. I see a lot of calcium deficiency in children. Just like iron deficiency, we see a lot of iron deficiency in children. Similarly, we see a lot of calcium deficiency in children as well as women. And even after taking calcium supplements, it does not get absorbed. And that's another issue which is causing a lot of problems in the body. How do you think that we should take calcium supplements, and how will it be absorbed in our body properly? What is the right time to
Actually,
take calcium?
the calcium deficiency, this issue can be addressed very well. We should remember two things. Sometimes we are taking the right amount of the calcium, but body is not able to absorb it
Yes, sir.
because we can keep on engulfing a lot of calcium tablets, but uh, we don't do any muscular exercise activity in the body
Okay.
until unless we are not doing the physical activity, or
Mhm.
the calcium will get absorbed. The medical sciences says if you want to improve calcium deficiency, take the vitamin D.
Yes, yes,
Vitamin
correct. I've
D
heard the
keep
same.
on they are driving new and new vitamin D1, vitamin D2, vitamin D3, so on, going on, endless. Latest has come vitamin D3 like it is a Hollywood and Bollywood. Basically, you take the best quality of the calcium preparations. Number two, you take the green leafy vegetables. They have enough amount of the calcium. Even fortified foods, and simultaneously you should do the regular your muscular activity, your body activity.
Mhm.
The children they are taking milk and many calcium preparations, but the whole day they remain with the WhatsApp. They don't do the physical exercise.
Yes, sir. Screen addiction is a big problem these days.
Yeah. Similarly, in the housewife also, in the women's also, the physical activity has become reduced drastically. Mental maybe they must have increased, but physical has reduced. And apart from that, the right source should be there, like green vegetable should be used extensively, fortified food should be used extensively. I think along with vitamin D3, if they can, or they should get exposure to the sunlight, exposure to sunlight, because once you are in sin, definitely the vitamin D3, the proper concentration will be there. But our body is capable enough to develop or synthesize the vitamin D3 in the presence of sunlight, and then use the calcium and improve your muscular activity. Maybe the games or walking, gym or swimming, whatever suits you. I think this deficiency we can overrule.
Correct. D3 is a permanently problem for everybody nowadays, because early in the morning we go to work, so we don't have time. We move from one pocket to another pocket, from one room to another room. We don't have time to spend in the morning sunlight. So yes, that's where we lose out the most, and we need supplements for D3.
Actually, the best time for sun exposure is early morning, not very bright, maybe around 9 o'clock, and 15-20 minutes is enough, not more than that. This is enough for our body. And our face should not be always with the sun side. It will be opposed to sun side. The ray should be come from the back, because the back surface is more better area to absorb the sunlight, yeah, as compared to the front face and other.
Okay.
So the back is there, and even when we are traveling or when we are going, we try that we should be, we should have a full exposure to the sun. I think then vitamin D3 you can take naturally, and remain on the natural food, leafy vegetables and all, and try to withdraw the junk food and fast food. They hamper the absorption of calcium.
Okay.
Because junk food and fast food, they give you taste, but they will not give you anything, neither for energy nor for your body. So
Correct.
these are the ideas by which you can improve your calcium deficiency.
So one more thing, I had a query that recently, I know somebody who has been suffering from, IBS and acidity, gastric problems for a very long time. So recently the person went for a blood test of minerals and all, and most of it was low, especially the B12 was very low. When he went to the doctor said that because of this continuous acid reflux that you're having, your body is not being able to absorb B12. And now the question is, sir, B12 is a very, very important vitamin in our body. And acidity is one of the most common problems that people are facing today. So if acidity will stop, I don't know, I'm asking this to you, does acidity or prolonged acidity in the body, does it hinder absorption of nutrients?
Yes, it's because when you have a acidity, means the patient is saying that in my stomach the pH is more than 4. It should ideally is 4. It must be 3.5 or 3.2, and that is why in that time most of the enzymes, they are not able to perform. Number 2, the acidity is already there, and whatever you will eat, definitely it will not get absorbed because it is being destroyed by your acidic culture. It will be destroyed. The vitamins are not able to perform well in acidic culture, in the hyperacidity. And you said about the B12, the right name is a methylcobalamin. B12 is a layman, methylcobalamin. So methylcobalamin is very important today because it has a lot of role in the body physiology. The most important to maintain your anxiety, depression, everything is dependent on B12 and methylcobalamin. Yes, and methylcobalamin, the source is basically has a very limited source are available. The milk products are the best, is the best sources because methylcobalamin is not available in the food, in our plant. It's not available in green salad and all. It is only available in the milk products. And milk product, we are taking less amount of it in a day. We take half cup or we take maximum 1 glass, which is not enough. Number 2, the methylcobalamin, they are most of our drugs, most of their medicine, they inhibit the absorption of the methylcobalamin. Most of the, and especially when you talk about the anti-diabetic drug, anti-hypertensive drugs, they basically, they inhibit the absorption or they interfere the absorption of the methylcobalamin. So one side, the diabetic patient is already suffering with the neurological complications. And other side, if he's not getting the proper amount of the methylcobalamin because he is taking anti-diabetic drug or anti-hypertensive drugs, so definitely the concentration will get deteriorated further. And the most important about the methylcobalamin, your caffeinated products, caffeinated. When you take more amount of tea, coffee, Kit Kat and all, so ultimately you are going to reduce the absorption of the methylcobalamin. So the best that when the methylcobalamin deficiency is there, deficiency is due to 2 basic reasons. One, our defective lifestyle, the defective food habits. We don't take much milk products. And number 2, we are taking knowingly, unknowingly caffeinated products.
Mhm.
And due to that, the absorption is poor inside the body. And that is why we are not having the proper amount of the methylcobalamin.
So
Even
what
in
would
children
happen?
also.
So what would happen if you have low methylcobalamin in the body?
A lot of complications will come. Most important is your nervous system will not perform well. The neurological complications will come. There will not be coordination between your body and your mind, because neurotransmitters, they will not get synthesized well. Neurotransmitters are nothing. They are the chemicals which are taking the reflex from mind to the, they are giving the instruction from mind to the body. These instruction goes for the, with the electrical impulses. These electrical impulses are always carried by the neurotransmitter with these chemicals, and these chemicals are being synthesized with the methylcobalamin. And until you don't have a methylcobalamin, your sleeping habit will get disturbed. Your appetite will reduce. Your voice will be changed. Fumbling will come, because the neurological, the control on the muscle will not be there. And unless the muscles are not being controlled properly by the nervous system, how your body will move. So the most important that there should be coordination between the muscles and the nervous system, and the best coordinator is a methylcobalamin.
Correct.
So we should either we should take a real good source of the methylcobalamin, like the milk products, if we are vegetarian. If we are non-vegetarian, the meat and all, they have a good amount of the methylcobalamin is there. And other side, we should reduce a caffeinated products, caffeinated.
So
So we
supplements work? Does supplements work?
yes, supplement works,
Oh,
because the source is limited. Now, methylcobalamin source is only, if you are a vegetarian, you have only one source in milk products.
so
And
what are
how many milk
the
products?
options for methylcobalamin supplements? What should we take?
We can use synthetic pills are available. Methylcobalamin,
Which family, sir? Which family?
we can the family is it belongs to vitamin B12 basically. So
Okay.
purposefully we should say methylcobalamin, because vitamin B12 has a many variety. It is a cyanocobalamin, hydroxycobalamin, adenosylcobalamin, but
Okay.
methylcobalamin, for us the methylcobalamin is most important as
Okay.
compared to any other cobalamin.
Okay.
Cyanocobalamin, which name itself is saying it is a cyanide, which is more toxic to our body. So we should avoid cyanocobalamin. We should avoid. We
Okay.
should use only
So,
methylcobalamin.
to my understanding, for my viewers, that whenever y'all are buying over-the-counter drugs, it is always advisable to at least read what are the ingredients. Especially in such cases, do not self-medicate yourself. You all need to visit a doctor and understand what is exactly needed after being tested properly. Blood tests are important. And only after that, you all can go and buy your drug. Don't buy it on your own. That's one thing which the doc, after all the conversation that I'm having with him, I'm understanding there has been many times that I have gone and bought drugs over the counter, but now I realize I wasn't doing a great job. So I'll stick to meeting a doctor and taking suggestions. Thank you for all this, sir. My final question that comes after this related to pharmacology is mental health crisis that is again skyrocketing these days, and not only adults, even children are getting completely hooked to anti-anxiety pills and SSRIs. What do you have to say about this? Do you think that these pills really work, or is there a particular tenure, a period that they should be taken, or is it like habit forming? Because many a times I have seen that when I have suggested my counselees to go and meet a psychiatrist, they say, no, I don't want to get into pills. Pills are not good. So in both the cases, it's more of a paradox, whether it is good or not good. Should we take, should we not take? Could you please put some ray of hope to us?
Actually, after the COVID, there's the anxiety, depression, they all are the complications or the complement of the COVID-19. It's a complement of COVID. Basically, the right word is insecurity. After the COVID, everybody has become insecure. Maybe the child, or maybe working class, they are not secure what is going to be happen tomorrow. And ultimately, it leads to the anxiety and depression. So for some extent, the anti-anxiety medications, selective serotonin reuptake inhibitors, they are effective. But it is true, they are most dangerous. Most dangerous. For time being, it is good. But as soon as you are better, you should withdraw immediately. But before starting the therapy, anti-anxiety or antidepressant or selective serotonin reuptake inhibitor, it should duly prescribed by my doctor friend. Should not use from the chemist. And as soon as the symptoms are over, with the supervision of the doctor or doctor's instruction, we should withdraw. The withdrawal is also very dangerous. We should not immediately withdraw anti-anxiety drugs because the complications are there. So basically, I request to all viewers that these drugs should not be used without any doctor consultation.
Correct.
And we should follow him very strictly because these drugs are very dangerous for our body. Instead of that, we should go for the natural therapy. I think natural therapy will be more effective even after COVID.
So, but I'll tell you, some cases are very serious. Like if I'm going to talk about the ones which I have seen, OCD cases, you just can't do without medicines. So that's one thing that I have noticed, that we have to ask the child to go and see a psychiatrist and, take help of medication. There are many other mood disorder cases which I have seen, in which you also need to administer anti-anxiety pills or SSRIs. So yes, it is not a happy thing, but true that we need these kind of medicines.
When the symptoms are there, definitely we should visit the doctor, psychiatrist, or maybe the good physician. We should follow him. We should follow him. We should not go directly to the chemist and buying it like we are buying a paracetamol. They are dangerous drugs. Like I mentioned earlier, that the steroids, antibiotics, antidepressant, anti-anxiety medications, they are quite dangerous for our body. Our body become more dependent on these drugs once we are taking. So how to remove, how to withdraw? There is a pattern. We should not withdraw immediately or by ourselves. It should be withdraw with the due permission or by the doctor, or he will definitely give you some maintenance therapy. Then after the maintenance therapy, it can be withdrawn. If you are withdrawing immediately without taking the maintenance therapy, definitely the drastical, unfavorable conditions will come, symptoms will come in our body, and that will be fatal and difficult to protect my patient.
Correct. Thank you, sir. Sir, we only talk about pharmacology and everything, but nowadays people are also moving towards some natural therapies or alternate medicines. Do you suggest that alternate medicines should also be given a thought, and we should take their refuge at times?
No, alternate medicines are really effective. It's quite effective. We should not believe it is a holistic, but really it is a good line of treatment. And alternative medicines, they are very much efficacious in our body. The most important is the natural. Number two, anytime you can withdraw also.
So, for example, like homeopathy or Ayurveda, so they have different approach towards the body. So, and like, I don't know whether you're going to now judge me, but I'm like more of an homeopathy person, and it really works on my body. So I feel that in some cases, some particular people, some medicines work. Allopathy doesn't work that well in some cases. Homeopathy works in some cases. Ayurveda works. So should people take things which work on them?
Actually, the alternative medicine should a complement
Okay,
and not replace the conventional medical treatment.
that is right.
It cannot
And
completely, it can be, a complement, but these alternative medicine, they cannot replace my alternative, these, our allopathic medicines. They cannot. You can continue, but they are not a real replacement of my allopathic medicines. They
right.
can be complement. They can be complement. In allopathic, there is evidences. A lot
Mm,
of extensive clinical trials are there. And when the evidences are there, documentation is there,
mm,
clinical trials are there, you become more confident. And
right.
when you talk about the alternative medicine, there is a lack of clinical trials, lack of evidences.
Mhm.
I should not say, I cannot say that they are not effective. They may be effective, but there's a lack of documentation, lack of evidence. We are talking science, Science means which you can prove it. You can see from your eye, but in alternative medicine, only you can see, but you cannot produce. You cannot document it until as there is no clinical trial conducted by Ayurveda or homeopathy. So that is why we are saying they can be a complement, but not be our conventional. Like liver disorder is a very common complication all over the world. A
Mm.
lot of allopathic and homeopathic medicines are available. They can be, they can do a little better when I am going to add with the allopathic treatment.
We really need to take care of our body at a very younger age. Now this is a message from my side to my viewers, that one thing is for sure: unless you move, unless your body moves, your body won't function, and slowly it is going to go to sleep. So every part of your body is slowing down with every passing year and is going to sleep. To keep it awake and active, you need to stay active. You need to keep moving. That's the first thing that I would say. What do you say, sir? Am I right?
Yes, the mobility is a correct word for our to maintain our body physiology
Yes. The
because
second,
our
the second thing is sun. Take the sun. You need the sun. That's the only resource that will keep you alive and give you energy. So get up in the morning and take some sun. Eat
correct.
well. Have nutritious food. Have enough foods. Meet a doctor when you don't feel well. Just don't go to the counter and ask for a medicine. You have a doctor by your side every year. Hundreds and lakhs of people are studying medical just so that we people who are the non-medical ones can live. So please give them that respect. Meet a doctor and take suggestion as to what kind of medicines should be taken. Do not self-medicate yourselves. And finally, I just want to say that thank you, viewers, for being here and listening to this conversation that I had with Dr. Sanjay Agrawal. Thank you so much, sir, for taking time out for me. I This is not enough. I know we have so many questions in our mind. Whatever comes next, I would really request you to come once more to this platform and answer as much as you can for us. It would be of great help to the viewers. Thank you so much, sir.
Thank you very much. Thanks a lot.